I have a question specifically to you about the hand condition.
Yeah.
It's called Quervaine tenosynovitis, and it's the degenerative condition of the first compartment extensor tendons that run along the thumb and attaches going toward the forearm, and there are these big, small, but major tendons of the thumb. So, when patients come to my office, I diagnose, we differentiate with our disorders, make sure that it's not a nerve condition or osteoarthritis at the base of the thumb, which is also very common, and I treat a lot of that. But also, something that's called intersection syndrome, which is a little bit lower in the forearm to diagnose. Probably some other also conditions like inflammation, maybe related to gout, especially if the joint is swollen or warm. And I'm thinking, that I don't necessarily want to inject patients. A lot of patients are very, hesitant to do injection as part of a first treatment. And some of them, especially with a darker skin color, worry about discoloration that may be a problem with the superficial injections because how potent steroids are. So I wanted to ask you about rehabilitation of this, the Quervaine condition or tenosynovitis, which is a condition we all use hands a lot. It's usually been attributed to young moms, but we know that it bridges much more than that. Anybody can have this condition. So how would you help the patient? What would you do?
Yeah, well, I mean, it first starts with a thorough history to figure out when, the onset and how it came about. I mean, oftentimes it's a repetitive stress condition. So, we'll learn that there's some sort of repetitive motions going on at the wrist and hand. And then we take it a step further and we usually learn that there's poor ergonomics or poor posture, right? So, the introduction of the device, the increased use time of laptops, it's putting people at a mechanical disadvantage. So if they're kind of slouched over and their wrists are flexed, and there's a lot of, repetitive stress with fingers and thumb, and this kind of what we call radial deviation, where you're moving your wrist inward. Maybe there's a mouse to the side if you're also with a desktop. It's just a perfect storm to get that tendinous junction there in the sheath to get irritated and inflamed locally and create some discomfort for people. And then what happens is if it's allowed to hang around for a while, grip strength becomes rather weak. Sometimes there's sort of this referred or radiating pain throughout the forearm, sometimes into the hand, and then it becomes very uncomfortable for people.
So that's a very interesting point that you brought up. So the history became so relevant in the telehealth because there's so much information that patient can provide you that you differentiate and narrow it down. But what I liked also is that you referred to what's the sign of time, that we all spend so much more time on computers typing. So the first thing is to alert patients that maybe there is something that they do incorrectly at their home, which they will not, if they don't pay attention to that or adjust, they're going to have this problem chronically.
Right. Yeah. So in physical therapy, we like to take a deep dive into the why, right? Because we can go straight into treatment and start addressing symptoms and the condition at large, but there was a cause. So let's find out what caused it. And, if we're in a telehealth environment, we can say, hey, show me your workstation, show me where you're spending a lot of time. If they're coming into the office, we say, just take some pictures or have someone take a picture of you at your workstation or a video and bring it in so we can just take a look at things and make some recommendations. So something called ergonomics, where we want to improve their posture, improve their workstation. And a lot of times it doesn't cost them anything. They don't need to go and buy these expensive gadgets, but rather it's a better positioning of their existing workstation, maybe their chair and adjusting height, their desktop or tabletop. So we make a few tweaks, and then, we go a step further and address some of the other symptoms and so forth. And one component too is diet. I mean, what are they eating? Are they eating a lot of foods with salt? So are they retaining a lot of water, right? And so things of that nature. Are they including anti-inflammatory foods? Are they getting their fruits during the day? And those little things go a long way. So we try to look at like the whole comprehensive picture.
Yeah, so, and you know, a lot of women come to me with this disorder, and they say that it dramatically limits them of doing things like yoga or Pilates. So they really want that for me to fix it very quickly. But I tell them, you know, and again, there's this hesitation for injections. So, and you know, the one of the first thing is to apply the thumb brace.
Yep.
And so I have a question to you. Do you usually recommend people to just get it somewhere and over the counter, or do you provide it in your office? Do you mold it in the office? How do you go about this bracing procedure?
Yeah, so to immobilize it, I mean, all the pharmacies are carrying reliable products now. So we'll usually advise them to go to the pharmacy locally, or they can go onto Amazon, and you can usually find yourself a good splint, and then they bring it in, and we'll verify that it's good quality, and yeah, and then you immobilize for a period of time, and then you address the inflammatory symptoms, and then you want to empower people with things that they can do themselves, so that they're not just relying on what's the physical therapist going to do. So that, in conjunction with applying some anti-inflammatory modalities locally to the tendon to help reduce that inflammation. And then sometimes too, there's some tissue density along the forearm. So as you start kind of poking around, on the extensor mass on top of the forearm, or on the front of the forearm, there's some tissue density. So sometimes we need to get in there manually and loosen up that tissue. Because if there's a lot of resistance and a lack of pliability throughout that forearm into the wrist and the thumb, that sort of painful cycle is just going to continue, even though they come out of the splint and we address the inflammation. So we want to get some of those secondary and tertiary impairments too.
So you mentioned manual therapy, which is, again, we're going back, but there is definitely need for this human contact and therapy contact. And, you know, there's just the healing in human touch. And I think you recognize it very vividly. And I'm going to ask you, so we all want to prevent the Quervaine tenosynovitis to our hands. How would you, what is the simple stretch or exercise that you can show to everybody who watches that they can strengthen their hand or hand joints or muscles to prevent injuries?
You got it. Yeah. Well, first, since physical therapists, we kind of consider ourselves movement experts and postural experts. I'd say first step is just make sure your workstation is correct. You're sitting upright in a chair. Everything's 90 degrees from the elbow, and they're close to the body when we're working at our workstation. So that's like the first and foremost. And whether you're a younger patient, like you mentioned earlier, with the video games, it's the same thing, getting upright and having the wrist in a neutral position. So if it's flexed and you're doing things like this on the keyboard, or if you're gaming and or texting, holding your device, get your wrists in neutral position.
Okay.
That's super important, and bring the device to your face rather than your face to the device. And that becomes very important too, and then the laptop, so often it's in the lap and we're cradled forward and hunched over. Put a pillow on the lap and get yourself upright if you're going to be on the laptop. Okay. So that's the first start. But in terms of stretching, just getting your elbow extended, arm extended out, and grabbing kind of just below the wrist joint and pulling down, and holding for a minimum 30 seconds. You should feel that stretch on the top of the forearm, even down across the wrist. The stretch should be comfortable and tolerable. It doesn't get looser faster if we pull on it harder. So I always tell patients, just find what's comfortable and tolerable, and then hold it for minimum 30 seconds. And then go ahead and flip it upward, and then now give it a gentle stretch up this way so that you feel the stretch on the bottom of the forearm. And that one's 30 seconds as well. And those, to prioritize, I think are really important. In terms of like when to stretch, it's good to stretch muscles that are warm rather than cold. So, to your point, what are some strengthening things? You could just as easily open and close your hands. If you have a stress ball, you could squeeze the stress ball. If you want to roll a ball of socks, you could squeeze some socks, but something just to get the blood moving. And again, I'm doing it with neutral wrists, and I would do it at the sides of my body. 30 grip squeezes just to get blood moving. Then I'd go into my stretching.
Okay, got it.
So that'd be like the right sequence to prevent any sort of Quervaines or any tendinopathies around the wrist or the elbow.
So that's very useful. I am definitely going to incorporate it in my busy day. And again, Michael, thank you so much for agreeing to do this interview. And I am looking forward, hopefully, to talk more about in the future, maybe some additional disorder. Maybe you can choose something that you can educate me about.
Sure, happy to. Yeah, thank you.
Okay, thank you.